The monitor flatlined at 11:42 p.m. Three doctors stepped back. One pulled off his gloves. A decorated special operations captain, 12 years of combat, 2 classified missions, a chest full of medals, was bleeding out on a stretcher inside a rattling military helicopter above a frozen mountain range, and the entire medical team had already decided he was dead. Nobody noticed the nurse standing near the rear hatch. Nobody ever noticed her. She was pale, quiet, and carrying a bag that looked older than half the crew. She looked like she belonged anywhere but here. And when she stepped forward into the light and said the 6 words that would change everything, "Move, you are not losing him." Every person in that helicopter made the same mistake. They underestimated her. If you've ever been overlooked, dismissed, or counted out before you even opened your mouth, stay with me until the very end. Hit that like button, subscribe if you're new, and drop a comment telling me what city you're watching from. I want to see exactly how far this story travels. The helicopter had no business being in the air. Wind shear had been hammering the Dravkin range since sundown, and the forecast called for whiteout conditions before midnight. But Captain Rowan Calloway's extraction team was already 2 hours behind schedule, and the colonel back at Forward Operating Base Whitmore had made his position clear. Get our people out or don't come back at all. So the UH-60 lifted off from a temporary landing zone carved into a frozen plateau, carrying 6 crew members, 2 field medics, 1 trauma physician, and a last-minute addition that nobody had properly cleared, a nurse from the Regional Military Support Hospital who had requested emergency transport authorization 3 separate times before a tired logistics officer finally rubber-stamped her paperwork just to get her out of the hallway. Her name was Sylvie Marsh. She sat at the rear of the cabin with her bag between her knees and her eyes forward, saying nothing to anyone. The crew hadn't asked her name. They hadn't asked her anything. One of the medics, a stocky sergeant named Briggs, had looked her over when she climbed aboard and immediately turned back to his equipment. She had seen that look enough times that it no longer registered as an insult. It was simply what happened. You were assessed in under 3 seconds, filed under not relevant, and forgotten. Fine. She had work to do anyway. 40 minutes into the flight, the radio crackled, and everything that had already gone wrong got worse. Falcon 1, this is Bravo Actual. Calloway's team is down. Repeat, Bravo is down. We have 1 survivor in transport. Heavy trauma, chest wound, status critical. ETA to your position, 11 minutes. The helicopter banked hard. Sylvie grabbed the overhead strap and braced. Beside her, the trauma physician, Dr. Marcus Veith, 46 years old, 3 tours in theater, reputation for being the best trauma surgeon the Eastern Military District had ever deployed, was already snapping orders at his medics, voice crisp and controlled in that particular way that meant he was running on adrenaline and experience and not much else. Sylvie watched him work. She didn't say anything. She was good at that. The survivor arrived by secondary extraction craft 11 minutes later, almost exactly as promised, transferred to their helicopter on a rigid litter that was already soaked through. His name was Captain Rowan Calloway. She had read his file 3 times on the flight up, which is why she knew about the cardiac arrhythmia diagnosed 6 years ago and flagged as non-disqualifying, and the previous chest trauma from a training accident in year 4, and the fact that Rowan Calloway's right ventricle was structurally thicker than average, which would matter very soon, though nobody in this cabin knew it yet except her. He was unconscious. His lips were gray-blue. The entry wound was left lateral chest, below the clavicle, and something about the angle, the way the blood had tracked, told her the projectile had ricocheted off the body armor before penetrating, which changed the trajectory entirely, which changed everything about what was happening inside him. Dr. Veith assessed him in under 90 seconds, called for the crash kit, and began running a protocol that Sylvie recognized immediately as the standard acute hemothorax intervention recommended by the Military Trauma Manual, 3rd edition, updated 4 years ago. She pressed her lips together. The manual was wrong for this patient, not wrong in general, wrong for this man, with this history, at this altitude, with the specific set of physiological responses she was already watching develop in real time. His neck veins were distending. His trachea had shifted fractionally to the right. His blood pressure, which Briggs was calling out every 45 seconds, was falling in a pattern that didn't match hemorrhagic shock alone. It matched something else, something she had seen twice before in her life, both times in places where she absolutely was not supposed to be. She reached into her bag and found the small laminated card she had made herself 5 years ago after the second time. She held it and waited. Veith worked fast. She would give him that. He was technically precise, confident, and clearly someone who had saved lives before. The chest tube went in clean. He called for blood. Briggs ran the IV lines like a man who had done it in worse conditions than this, which he probably had. Calloway's pressure dropped another 8 points. Sylvie stood up. Dr. Veith? He didn't look at her. She tried again, louder. Dr. Veith, I need 60 seconds of your attention. He looked up then, and the expression on his face was one she had catalogued extensively over the years. It was the look that said, "Who let you in here, and why are you speaking?" Sit down, he said, flat. Not cruel, just completely certain that whatever she was about to say was beneath the threshold of relevance. This is a controlled situation. His pressure is in freefall, and it's not responding to the chest drain, she said. That tells you this isn't a straightforward hemothorax. I think he's developing altitude-induced right heart failure layered on top of the penetrating wound. His arrhythmia history combined with the cabin pressure at this elevation. I have his file, Veith said. Then you saw the cardiac notation. I saw a flagged anomaly that was cleared for service. He had already looked back at Calloway, which means it's not the primary concern. It wasn't the primary concern at sea level, Sylvie said. We are currently at 9,000 feet and climbing. Briggs glanced at her, just for a second, then he looked away. Veith did not look at her again. She stood there for a moment, the monitor screaming, the wind hammering the fuselage, 6 other people in the cabin, all carefully not making eye contact with her, and understood with crystalline clarity that she had approximately 3 minutes before the window closed entirely. She sat back down. She opened her bag. She pulled out the compound she had synthesized under supervision during her last posting, the one that the review board had called clinically unsubstantiated and outside standard deployment parameters, before they shelved her application and reassigned her to a logistics hospital 200 miles from anywhere interesting. She held the small sealed vial and looked at the ceiling of the helicopter and did the calculation she had been doing since Calloway arrived. Risk of action versus risk of inaction, weighted against everything she knew and everything she was still not certain of. The monitor flatlined. The sound was so familiar and so terrible that it managed to cut through the engine noise and the wind and land in the chest of every person in that cabin like a physical blow. Veith called for the defibrillator. He ran the protocol. He shocked Calloway once, watched the monitor, called again, shocked him twice. Nothing. He worked for 90 seconds that felt like 20 minutes, and then, not dramatically, not theatrically, but with the quiet efficiency of a man who had learned how to do this without destroying himself, he stepped back. He pulled off one glove, then the other. Time of death, he began. No. Her voice was not loud. It didn't need to be. Something about the way she said it, the absolute bedrock certainty of it, cut through everything else in the cabin the way a fire alarm cuts through sleep. Veith turned. Sylvie Marsh was already standing, already moving, already at the stretcher, and the expression on her face was something none of them had seen from her before because they hadn't been paying attention before. She wasn't asking permission. She wasn't making a suggestion. She was working, and the shift was so sudden and so complete that for a full 3 seconds, nobody moved to stop her. I need the defib on standby, she said. I need the cardiac monitor leads repositioned. Move the V4 lead here, not there, here. And I need whoever is running that IV to slow the rate by 30% immediately. You don't have authorization, Briggs started. Are you going to take responsibility when he dies? She looked at Briggs directly, not angry, not aggressive, just completely, terrifyingly calm. Because Dr. Veith just stepped back. So right now the only person actively trying to save this man is me, and I need you to either help or get out of my way. Briggs looked at Veith. Veith was watching Sylvie with an expression she couldn't quite read. He said nothing. Briggs moved the lead. She was already drawing the compound, already checking the dosage she had run through in her head 4 times since they'd received the radio call, already calculating weight and altitude and cardiac history, and the specific way Calloway's body had been responding to treatment that wasn't built for him. She leaned down close to his ear. The cabin was watching her. All of them. Veith with his gloves balled in his fist, Briggs with his hands hovering over the monitor. The second medic, a young woman named Prado, who had not said a single word in the last 10 minutes, but whose eyes were wide and very alert. Sylvie spoke quietly. The words were not for the cabin. They were for Calloway, or for whatever part of him was still inside the noise and the dark and the cold. Iron Vale, she said. I am at your 6. She administered the compound. She stepped back from the stretcher. Nobody breathed. The defibrillator discharged once. The monitor drew a flat line. Then, ragged, irregular, wrong-looking but present, a beat. Then another. Then a third that was stronger than the second, and a fourth that was stronger than the third. And Calloway's blood pressure on the readout began moving in the direction that blood pressure was supposed to move. And Prado made a sound that wasn't quite a word, and Briggs said something under his breath that Sylvie didn't catch. And the helicopter kept flying through the dark above the Dravkin range, while a man who had been declared dead rebuilt himself beat by beat on a stretcher in the freezing cabin. Veith stared at the monitor for a long time. Then he looked at Sylvie. She was already writing in a small notebook she'd pulled from the front pocket of her bag, documenting dosage, timing, patient response, exactly the way she'd been trained and exactly the way she always did, even when nobody was watching, especially when nobody was watching. What did you give him? Veith asked. His voice was different now, quieter. The authority was still there, but it had shifted around something else, around the fact that he had been wrong, and the monitor was telling him so in real time. A compound I developed during my posting with the Crestfall Mountain Division, she said without looking up. Altitude-adjusted cardiac stabilizer, modified from a base protocol that already exists in the literature. I submitted a formal application for clinical review in 2021. It was rejected. A long pause. By who? The Military Medical Standards Board. She capped her pen. They said there was insufficient field data to justify approval. Nobody spoke. Then Calloway's eyes moved behind his closed lids, the smallest flutter, there and gone, and Sylvie turned back to the stretcher and said, I need someone to tell me our current altitude, and I need that IV rate adjusted again. He's going to need active monitoring for the next 40 minutes, or we could still lose the progress we've made. Briggs moved to the monitor without being asked twice. Prado adjusted the IV. Veith stood to the side and watched her work. She didn't need him to participate. She didn't need his validation, or his approval, or his acknowledgement that something extraordinary had just happened in this cabin. She needed the altitude reading and the IV adjustment, and for everyone to stay focused on the patient, because Calloway wasn't out of the woods, and she had learned a long time ago that the moment you believed the crisis was over was often the moment it came back to finish what it started. 11,200 feet, Prato said. We need to descend. Talk to the pilot. Sylvie didn't look up. Request a lower altitude, 8,000 if they can manage it. Tell them it's medical necessity. Prato moved to the cockpit without checking with Veith. Sylvie registered this and filed it away. Not with satisfaction. Satisfaction was a luxury for after. But she registered it. She had been invisible for a long time. 14 years, if she was counting precisely, and she was. She had been the person in the room that other people looked past, looked through, or simply didn't look at all. It had started in medical school, where she had been one of 3 women in a class of 31, and had learned early that being the most prepared person in the room did not automatically make you the most heard. It had continued through her early military postings, where she had watched men with less experience and less precision receive promotions and commendations while her own recommendations circulated in committee for months before being quietly shelved. It had calcified during the Crestfall posting, 18 months in the hardest terrain she'd ever served in, developing protocols under conditions that no review board member had ever experienced and probably never would, and coming home to a panel of 7 men in a climate-controlled room who had told her that her work was interesting but unproven. She had kept working anyway. Because that was the thing about being ignored. It left you alone with the work, and the work was what mattered. The helicopter began a gradual descent. Calloway's vitals stabilized slowly, unevenly, the way real recovery always worked. Not a clean line upward, but a jagged climb with setbacks and plateaus, and one terrifying dip around the 14-minute mark that had Sylvie repositioning the oxygen delivery before the monitor even had time to alarm. Veith watched and occasionally asked questions, and she answered them without editorializing, giving him the clinical reasoning behind each decision in the same tone she would use briefing a colleague. He was a good clinician. She could see that clearly now, from the inside of the work instead of from the outside. He had been working with incomplete information and a patient profile that didn't match the standard presentation. He had made reasonable decisions based on what he knew. The problem was that he hadn't known enough. The problem specifically was that he hadn't known her. 22 minutes after the compound was administered, Calloway's pressure crossed into the stable range and held there. Veith exhaled, a long, controlled breath that he probably thought nobody noticed. Sylvie noticed. She had been noticing things about people for a long time. "What's the base formula?" he asked. He had his own small notepad out now. "The core compound. I can write it out for you." "Please." She wrote it out in her clear, small handwriting and tore the page from her notebook and handed it to him. He read it carefully, asked 2 follow-up questions that were good questions, and then looked up. "You modified the vasopressor interaction," he said. "At altitude, the standard ratio causes overcorrection in patients with pre-existing right heart thickening. I adjusted the ratio by 40%. 37, she said. He looked at her. Not the earlier look. Not the who let you in look. Something else. Something she was less practiced at reading because she had seen it less often. "I stopped treatment," he said. "Yes. He stopped. Looked at Calloway on the stretcher. "He would have died." "Yes." Veith was quiet. "Then, why didn't you push harder? Earlier when I dismissed you, you knew what was happening." She considered the question carefully, because she had asked it herself many times in many situations over many years. "Why didn't you fight harder? Why didn't you shout? Why didn't you demand to be heard?" "I did push," she said. "I told you what I saw. You made a decision." She paused. "I went around the decision." "You waited until he flatlined." "I waited until the window that would have worked," she corrected. "If I had administered the compound earlier, before the cardiac event fully expressed, the diagnostic picture would have been muddier. The outcome might have been the same, but the evidence for the protocol would have been harder to isolate." She looked at him steadily. "I needed it to work clearly, not just for him, for the record." Veith stared at her. She held his gaze. "That's either the most calculated thing I've ever heard," he said slowly, "or the most dedicated." "It's both," she said. "Those aren't mutually exclusive." The rest of the flight passed in focused, concentrated quiet. She monitored Calloway's vitals in 12-minute intervals, adjusting as needed, maintaining detailed notes that she intended to submit, again, to the Medical Standards Board the moment they landed. The case study was clear now. The outcome was documented. They would have a harder time calling it insufficient field data with an active patient record attached to the submission. They would try. They always tried. But harder was different from impossible. 30 minutes out from the base hospital, Calloway's hand moved, just slightly. A slow curl of his fingers against the litter, the way hands moved in deep sleep when something in a dream shifted. Sylvie watched it and didn't say anything, but she moved her own hand slightly closer to his, not touching, just present, in case he was looking for something to hold on to in wherever he was. His lips moved. She leaned in without thinking. "Evie," he breathed, barely audible. A sound from somewhere much further away than this helicopter, this night, this mountain range. "Evie." She pulled back slowly. Her name was Sylvie. Nobody had called her Evie since she was 23 years old, fresh out of her first field posting, sitting beside a fire with 3 other soldiers in a forward operating position that no longer appeared on any official map. She looked at Rowan Calloway's face, the angle of his jaw, the scar along his left brow that hadn't been in his file, the particular way his features arranged themselves, even unconscious, and the recognition moved through her like something physical. She had known him. She had known him under a different operational designation, in a different life, before this hospital badge and this worn bag, and this particular brand of invisibility she had built around herself like a second uniform. Before the posting that had ended badly. Before the reassignment she had accepted without appeal. Before the night she had walked away from classified work and told herself it was a choice. She looked at him for a long time. Then she looked out the window at the dark below, at the lights of Coldwater Station beginning to appear through the cloud cover as they descended, and she thought about the after-action reports she had read on Calloway's last 3 missions. Public records. Nothing classified. The kind of thing you could pull if you knew where to look. and specifically about the mission tonight that had been called routine in the briefing and had ended with 5 soldiers dead and 1 barely alive in a helicopter she had worked hard to be on. Routine. She pressed her lips together. There was no version of tonight that was routine. She had been trying to reach Callaway for 6 days before this. 6 days since she had seen the deployment notification cross a channel she wasn't supposed to be monitoring anymore. 6 days of paperwork and phone calls and stonewalled requests before a tired logistics officer stamped her transport authorization at 11 p.m., and she sprinted to a helicopter that was already spinning its rotors. She had made it, but 5 soldiers hadn't. And somewhere in the gap between what the briefing had said and what had actually happened to Callaway's team in the Dravkin Range tonight was a question she had been carrying since the moment she read the extraction report, a question that had no comfortable answer, a question that she was going to need to ask very carefully and very strategically, and only when she was standing on solid ground with Callaway alive and stable beside her. The helicopter began its final approach. Sylvie Marsh put her notebook away, smoothed the front of her jacket, and looked one more time at the man on the stretcher, breathing, stable, fragile, alive. And the word he had whispered settled somewhere in her chest and refused to move. The wheels hit the landing pad at 1:17 a.m. Briggs began calling the ground team. Veith was already on the radio with the surgical floor. The cabin became organized chaos. The good kind. The kind that meant someone was going to survive the night. Sylvie gathered her bag. As they transferred Callaway to the ground stretcher, his eyes opened, just for a second. Heavy-lidded, unfocused, the dazed blankness of a man with one foot still somewhere else entirely. He scanned the faces around him with the automatic, trained sweep of someone whose instincts ran deeper than consciousness. His eyes landed on her, and stayed. She didn't move, didn't speak, waited. He looked at her the way someone looks at a thing they can't quite believe is real. Not dramatically, not the way it happened in films, but with that particular fragile disorientation of a person trying to reconcile what they're seeing with what they thought was possible. Then the ground crew was moving, and the moment passed, and Callaway was gone through the hospital doors, and she was standing on the landing pad in the cold wind with her bag over her shoulder and Dr. Veith beside her, and the base hospital was lit up ahead of them like a tower against the black sky. "You're not on the surgical team," Veith said. "No. You're not credentialed here." "No." He was quiet for a moment, then, "I'm going to authorize a temporary clinical consultancy. 24 hours. If anyone asks, you're on my team." She looked at him. "Why?" she asked. "Because I want to watch what you do next," he said. It wasn't a compliment exactly, more an admission, the kind that costs something to say. "And because that man on the stretcher said your name." She turned and walked toward the hospital doors. Behind her, the helicopter rotors were spinning down. Above her, the Dravkin Range sat invisible in the dark, holding whatever had happened up there like a secret that hadn't decided yet whether it was finished. Somewhere inside the building, Rowan Callaway was being wheeled toward an OR. And somewhere in the 12 floors of Coldwater Station Military Medical Center, in filing systems and personnel records and mission logs, and one specific decommissioned operational database that she absolutely should not still have access to, were the answers to the questions she hadn't asked yet. She pushed through the door. The light was very bright inside. She kept walking. The hallways of Coldwater Station Military Medical Center smelled like antiseptic and recycled air, and something underneath both of those things that Sylvie had never been able to name. The particular smell of a building where people came to either survive or not. And the building itself had absorbed so many years of both outcomes that the smell had become its own thing entirely. She followed the surgical gurney from a distance, because nobody had told her she could follow it and nobody had told her she couldn't, and in Sylvie's experience that ambiguity was usually navigable if you moved with enough purpose and kept your badge visible and didn't make eye contact with anyone who looked like they might have authority over the situation. Veith was ahead of her, already talking to the surgical resident who had met them at the door. A young man named Okafor, whose scrubs were slightly too big, and whose eyes had the particular sharpness of someone running on his second consecutive overnight shift and compensating with attention. She caught fragments of Veith's briefing as she walked: penetrating chest trauma, right ventricle involvement, altitude-induced cardiac event, stabilized en route with. And then they were through the double doors into the surgical prep area, and an orderly stepped into the gap and held up one hand. Credentialed staff only past this point. I'm with Dr. Vaith's team, she said. The orderly looked at her badge. Her badge said Marsh, S. Nursing, Lakemore Regional Support Hospital. It did not say Coldwater Station. It did not say surgical clearance. It very clearly said everything the orderly needed to know about whether she belonged on the other side of those double doors. I'll need you to wait in the family consultation area, he said. She held his gaze for a second longer than was comfortable, then stepped back. The doors closed. She stood in the corridor alone with her bag and the antiseptic smell and the fluorescent lights that were slightly too bright in the way of all hospital corridors everywhere. And she breathed in once, slowly, and thought about the next 18 hours with the methodical precision she applied to everything, which problems required immediate action, which required patience, and which required a careful, deliberate navigation of systems that were not built for people like her. The waiting area was beige. It was always beige. 4 chairs, a table with outdated magazines, a wall-mounted screen cycling through base announcements that nobody was reading. She sat in the chair closest to the corridor and opened her notebook. She had work to do. The case documentation came first. Calloway's presentation, her assessment, the compound formula and dosage, the timing of administration relative to cardiac event, the monitored response over the subsequent 40 minutes. She wrote it all in the clear, precise language of clinical documentation, the kind that left no room for interpretation or dismissal, the kind she had learned to write after the first 2 submissions were returned with notes suggesting her methodology was anecdotal. Clinical documentation was a language like any other, and she had become fluent in it the hard way, by having her earlier drafts rejected until she understood exactly what the word anecdotal meant when applied to the work of a woman who was not affiliated with the right institution. It meant, we can ignore this. It meant, you don't have the right letterhead. She wrote until the words were airtight. 40 minutes passed, then an hour. The corridor outside stayed busy with the specific controlled urgency of a military medical facility at 2 in the morning, people moving with purpose, nobody wasting motion, conversations conducted in the compressed shorthand of people who had long ago trimmed language down to only the load-bearing parts. A woman appeared in the doorway of the waiting area. She was perhaps 50, wearing the insignia of a hospital administrator, and she had the look of someone who had been called from sleep and was managing her irritation with professional effort. Ms. Marsh? Yes. I'm Deputy Director Callum. I understand you were on the extraction helicopter with Dr. Vaith. That's correct. Callum came into the room but didn't sit. She held a tablet in front of her like a small shield. I've reviewed your transport authorization. It was issued for a logistics transfer, not clinical deployment. The clinical situation required adaptation, Sylvie said. That's one way to describe it. Callum glanced at the tablet. Dr. Vaith has submitted a request for temporary clinical consultancy on your behalf. I'm here to tell you that I can't approve that without a full credential review, which will take a minimum of 72 hours. The patient may not have 72 hours of recovery without monitored intervention. That's what our surgical team is for. Sylvie looked at her steadily. Your surgical team wasn't on that helicopter. Callum's expression didn't shift, but something tightened around her eyes. Ms. Marsh, I understand that you provided emergency assistance under field conditions, and I'm sure that Dr. Vaith will reflect that in his report. But this is a credentialed facility with established protocols, and I'm not in a position to grant surgical floor access to someone who isn't cleared for this location. I'm not asking for surgical floor access, Sylvie said. I'm asking to be available for consultation during the immediate post-operative window. I can do that from this room. I can do that by phone. But the compound I administered is not in your hospital's formulary, and the post-op monitoring protocol for a patient who received it is different from standard procedure, and the only person here who fully understands both of those things is me. A pause. Write it down, Callum said. Everything about the compound, the dosage, the monitoring requirements, I'll have it relayed to the surgical team. I already have, Sylvie said. She tore the relevant pages from her notebook and held them out. Callum took them, glanced at them, and said nothing. Then she turned and left. Sylvie looked at the empty doorway for a moment. Then she turned back to her notebook and kept writing. Vaith found her at 3:47 in the morning. He came in still wearing his surgical cap, which he pulled off and folded as he sat down across from her. And he had the look of a man who had been running on adrenaline for several hours and was beginning to feel the drop. He was also, she noticed, carrying 2 cups of coffee from the staff room, and he set one in front of her without comment. She looked at it, then she picked it up. He's out of surgery, Veith said. Complications? Less than expected. The right ventricle, your concern was correct. The surgical team found scarring consistent with what you described, and the approach they would have taken without that information would have created pressure complications during closure. He paused. Okafor adjusted the technique based on your notes. She absorbed this without expression. He's going to need careful monitoring for the next 8 to 12 hours, she said. The compound interaction with standard post-op analgesics. I briefed Okafor thoroughly. He looked at her. He has your notes. He's a careful clinician. I know, she said. I watched him for about 40 seconds in the corridor. He's good. Veith almost smiled at that. Almost. Deputy Director Callum denied the consultancy request. I know, she told me. I'm going to escalate it in the morning when the base commander's office opens. You don't need to do that. I'm aware I don't need to, he said. I'm going to do it anyway. He wrapped both hands around his coffee cup. That protocol you used, if it had been approved when you submitted it, how many patients would that have changed the outcome for? The question was genuine. She could tell the difference. Genuine interest had a different texture than the kind of question people asked when they wanted to appear interested while actually formulating their next dismissal. She thought about it honestly. Based on the caseload data I reviewed before submission, altitude-related cardiac events in deployed personnel with pre-existing right heart anomalies, I estimated between 4 and 7 cases per operational year in high-elevation theaters alone. That's just the cases that fit the specific profile I documented. She paused. There are probably adjacent presentations where the modified protocol would show benefit. I didn't include those in the submission because I didn't want to overstate. Veith was quiet for a moment. You understated, he said. I thought it was safer. They were already looking for reasons to dismiss it. And they dismissed it anyway. Yes. He looked at his coffee. I want to read the full submission, not the summary, the full document. She reached into her bag and pulled out a folded copy she had been carrying for 2 years, because she had learned that opportunity appeared without warning, and it was better to always have it on hand. She set it on the table between them. He picked it up. She watched him read. At 6:15 in the morning, a sergeant appeared in the waiting area doorway with the specific bearing of someone executing a task they'd been given and were not entirely comfortable with. Ms. Marsh? Yes. Captain Calloway is in recovery. He's asking for you. She stood. Is that cleared? She asked. The sergeant looked briefly pained. The nursing supervisor on the recovery floor said she'd allow a 5-minute visit, family consultation basis. Sylvie picked up her bag and followed him. The recovery floor was quieter than the rest of the hospital, the way recovery always was. A hushed, fragile quiet that had nothing to do with peace and everything to do with the effort it took to keep breathing. Calloway was in a private room at the end of the corridor, and through the window she could see him before she went in. Propped slightly, still gray-faced, IV lines tracking along both arms, the oxygen monitor clipped to his index finger. She went in. He was awake. Barely, but awake. The kind of awake that was about 15% consciousness, and the rest was the body's refusal to go back to wherever it had nearly gone for good. Sylvie, he said, his voice was wrecked. Not from emotion, from the intubation, from the hours, from whatever damage the chest wound had done to structures adjacent to his vocal cords. Don't talk yet, she said. How long? 4 hours since you arrived. You've been out of surgery for about an hour. She moved to the side of the bed and checked his monitor without asking, read his pressure and O2 sat and heart rhythm with the quick assessment she'd been doing automatically since long before she had the formal training to name what she was reading. You're stable. He looked at her. His eyes were clearer than they should have been for someone in his condition, which told her something about the kind of person he'd trained himself to be. The kind whose mind insisted on coming back before the body was ready. You were on the helicopter, he said. Yes. You... He stopped, breathed, tried again more carefully. You shouldn't have been. Someone had to be. Something moved through his expression that she couldn't quite name. They told me I didn't make it for a minute. 90 seconds, she corrected. Give or take. Give or take. He almost laughed, which hurt him. She could see it in the tightening around his eyes. He let it pass. The mission was supposed to be a sweep, 40-minute extraction. I know. There were 6 of us. She held his gaze, said nothing. 5 of them knew we were coming, he said. Not a question. Not quite a statement either. Something in between, the way people spoke when they were saying the thing they'd been circling since consciousness returned. The position they had us in. That's not ambush positioning. That's trap positioning. They knew the exact route. Calloway. She kept her voice low. Not now. Yes, now. His jaw tightened. 5 of my people are going to get justice, she said quietly, but not in the next 5 minutes, and not while you're one wrong reading away from a secondary cardiac event. So you're going to stop talking and let me look at your monitor, and you're going to still be alive tomorrow, because this conversation requires you to be alive tomorrow. He looked at her. She looked back. He exhaled and closed his eyes, and she turned to the monitor, and the room was quiet enough that she could hear the rhythm of his breathing gradually. Not quite settle, not quite calm, but hold. She stayed for 12 minutes, not 5. The nursing supervisor appeared in the doorway at the 8-minute mark, and Sylvie looked at her with an expression that said 4 more minutes, in a way that apparently translated clearly, because the supervisor withdrew. When she left the room, Calloway was asleep. She stood in the corridor and looked at the wall and thought about what he'd said. Trap positioning. And the words sat in her chest with the particular weight of a thing that confirmed what you already suspected and made it worse by confirming it. She had known this wasn't routine before she boarded that helicopter. That was why she had boarded it. The base commander's name was Colonel Dara Whitfield, and Sylvie met her for the first time at 9:30 in the morning in a conference room on the administrative floor that had the same beige carpet as the waiting area and a window overlooking the landing pads where, 9 hours earlier, a helicopter had touched down carrying a man who was supposed to be dead. Whitfield was 53, compact, with close-cropped gray hair and the kind of stillness that came from decades of being the person everyone else was looking at when things went wrong. She sat across the table from Sylvie with a legal pad in front of her and a cup of coffee that she hadn't touched. Veith was there. So was a JAG officer named Sorrel, who had been introduced quickly and hadn't spoken since. The deputy director Callum sat at the end of the table and had the look of someone who had spent the last 6 hours revising her assessment of a situation. Ms. Marsh, Whitfield began, I've reviewed Dr. Veith's report from last night, the surgical team's notes, and the clinical documentation you submitted during the waiting period. I've also been briefed on the extraction circumstances. All right, Sylvie said. I want to be clear that this conversation is not disciplinary. You operated under field emergency conditions, and the patient outcome supports the decisions you made. Whitfield paused. What I want to understand is why you were on that helicopter. I requested emergency transport authorization. You requested it 3 times over a 6-day period, starting 4 days before the Dravkin extraction was even scheduled. Whitfield's voice was measured, not accusatory, measuring, like she was weighing each word before she committed to it. That's a notable timeline. Sylvie had prepared for this. She had prepared for it on the helicopter and in the waiting room and in the corridor outside Calloway's recovery room. I had reason to believe Captain Calloway's deployment carried elevated risk, she said. What reason? Prior knowledge of the operational environment and of the captain's medical profile. Sorrel, the JAG officer, leaned forward slightly. What was the nature of your prior relationship with Captain Calloway? Sylvie looked at him. Operational. We served in overlapping postings approximately 7 years ago. I had access to his medical history from that period. Which posting? She held the pause precisely as long as she could justify. Classified deployment under the Crestfall Mountain Division. My records from that period are sealed under operational security protocols. Sorrel wrote something down. I'm going to need to verify that, Whitfield said. I'd expect nothing less. Whitfield regarded her for a moment, the kind of regard that took measure without revealing what it found. The immediate issue is your clinical status at this facility. Deputy Director Callum has denied temporary consultancy clearance. Dr. Veith has appealed that decision to my office. She folded her hands on the table. I'm going to override Callum's denial. Callum's expression shifted by approximately 2 millimeters. She said nothing. You'll be granted 48-hour consultancy clearance for Captain Calloway's case specifically, Whitfield continued. Dr. Veith will co-sign all clinical recommendations. At the end of 48 hours, we reassess. Thank you, Sylvie said. Don't thank me, Whitfield said. The patient is alive because of what you did on that helicopter, and that is the only reason we're having this conversation instead of a different one about unauthorized medical intervention. Do you understand the distinction? Completely, Sylvie said. What she did not say, that she had understood that distinction before she boarded the helicopter, and she had boarded it anyway, and she would make the same decision again in the same circumstances without hesitation, and the outcome had been the only argument that ever really mattered, which was why she had made sure the outcome was airtight before she gave anyone the chance to argue against it. The 48 hours were not clean. Nothing was ever clean. She knew that going in. Calloway's post-op course ran into complications at the 16-hour mark. A fever that climbed faster than it should have, and a blood pressure reading that kept dipping when he shifted position, requiring a medication adjustment that Sylvie caught during a routine check and flagged before the floor nurse had noticed it. The floor nurse's name was Hennessy, and she was experienced and thorough, and she had, at the beginning of this, the same look that everyone had given Sylvie at every point in her career. The look that said, "I'll manage, thank you, that's not your department." By the second day, Hennessy was leaving Sylvie her coffee when she came on shift. Small things. The way the world actually changed. Not in declarations, but in small things. Calloway himself was the difficult patient, in the specific way that capable people were always difficult patients, which was that he treated recovery as a problem to be solved on an aggressive timeline and kept trying to negotiate his way to mobility faster than his body was built for. He wanted to sit upright. He wanted to review his mission debrief. He wanted to make phone calls that Sylvie strongly suspected were not personal calls, and which she intercepted on the second morning by simply taking his phone off the bedside table and putting it in her bag without discussion. "That's my property," he said. "That's your cardiac monitor," she said, pointing to the screen. "That number needs to be above 60 before you start making calls that are going to elevate your heart rate." "How do you know what the calls are?" "I know you," she said. "The number is 54. He looked at the monitor, looked at her, did not get his phone back. They talked, when he was well enough to talk and she was in the room, in the fragmented, non-linear way of people who had shared history that neither of them had fully processed because circumstances had not allowed for processing. It came out in pieces, references, half-sentences, names of places that didn't appear on public maps. She didn't push. He didn't avoid. They were both people who had learned to move around the edges of things that were better approached sideways. On the second afternoon, he said, "You knew it was a trap before I did." "I suspected," she said. "How?" "The routing," she said. "I saw the extraction route in the transport documentation. There's a specific approach to that plateau that only makes tactical sense if you know in advance what atmospheric conditions are going to be on the night. That route was chosen for weather cover. Someone with meteorological intelligence and inside knowledge of the extraction timeline chose it." She paused. "That's not field intelligence, that's planning, internal planning." Calloway was quiet for a long moment. "You couldn't have known that from transport documentation," he said. "No," she agreed. "I also accessed the mission planning archive, informally. Informally. I still have a login that wasn't properly deactivated when I was reassigned," she said. "That's an administrative oversight, not an authorization." He looked at her with an expression she remembered from 7 years ago, the one that meant he was recalibrating. "Sylvie." "Yes." "Are you currently conducting an unauthorized intelligence review of a classified military mission?" "I'm a nurse," she said evenly, "conducting a welfare check on a patient's safety context, which is entirely within my consultancy scope." A long silence. Then, "What did you find?" She took a breath. "I found a discrepancy between the intelligence assessment that was used to classify the mission as routine and the raw signal data that assessment was supposedly based on. The raw data didn't support the routine classification. It would have supported an elevated risk designation, which would have triggered a different extraction protocol, a different route, a different timeline." She looked at him. "Someone altered the assessment between the raw data and the final report." The monitor beeped steadily. Calloway's pressure had gone up 4 points. "That's enough," she said. "That's enough for right now." "Who?" he said. His voice was very quiet and very controlled. "I don't know yet." "But you have a direction." She looked at him for a moment. The alteration was made by someone with Level 4 intelligence access and administrative authority over mission planning documentation. That's a specific category of personnel. It's not a long list. No, he said. It isn't. She watched his face, the way he processed it, the way something settled into him that wasn't acceptance but was something adjacent to it. The specific resolution of a person who has just had their worst suspicion confirmed and is now simply deciding what to do with the confirmation. You need to rest, she said. I know. Your pressure is... I know, he said again. He closed his eyes. His hands, on top of the blanket, were very still. Sylvie. What? Thank you for being on the helicopter. She looked at him. The gray still in his face, the IV lines, the monitor reading that was finally, slowly tipping back in the right direction. And she thought about 6 days of paperwork and stonewalled calls, and a logistics officer who'd stamped her authorization at 11 p.m. without reading it properly, and the moment on the helicopter when she had stood up and said no into a room full of people who had already moved on. Don't make me do it again, she said. The trouble started on the morning of the third day. She had just completed Calloway's morning assessment and was writing up her notes in the corridor outside his room when she heard the voices coming from the administrator's wing. Not loudly, not the way crises presented when they were being managed. Quietly, which was worse. She looked up. Deputy Director Callum was walking toward her with 2 men she didn't recognize. Not medical staff, not base personnel in any configuration she'd seen here. They wore civilian clothes and carried the specific stillness of people whose stillness was professional, and one of them was holding a folder that was the particular shade of administrative beige that meant something official was inside it. Callum stopped in front of her. Ms. Marsh, this is Mr. Graft and Mr. Heiser from the Military Medical Standards Board. The name landed differently than names usually did. Sylvie kept her face neutral. Your 48-hour consultancy period has concluded as of 6 a.m. this morning, Callum said. These gentlemen are here to discuss the unauthorized use of an unapproved compound during an extraction operation. Captain Calloway is not yet stable enough for me to... Dr. Okafor will manage Captain Calloway's ongoing care. Callum's voice was not unkind, which was almost worse than if it had been. Your access to this facility and to the patient is suspended effective immediately, pending a formal inquiry by the Standards Board. Graft, the shorter of the 2 men, opened the folder. Ms. Marsh, you're required to submit all documentation related to the compound administered on the evening of the 14th, including synthesis records, dosage calculations, and any prior trial data. She looked at him, then at Callum, then, briefly, at the folder. You're opening an inquiry, she said, not a review. An inquiry. The distinction is that a review is designed to evaluate evidence, she said. An inquiry is designed to assign liability. She kept her voice exactly level. I'd like to know who requested this inquiry. Graff's expression didn't move. That information isn't relevant to... It's extremely relevant, she said. I submitted this protocol for clinical review in 2021. It was denied. Last night it saved a captain's life in conditions that your approved protocols would not have addressed. If this facility is now opening an inquiry rather than a review, I want to understand who made that decision and when. Callum looked briefly uncomfortable. It was the first genuine crack Sylvie had seen in her composure. The inquiry was requested through the Standards Board's standard oversight mechanism, she said. By whom? Sylvie said. Nobody answered. She picked up her bag from the floor. I'll need a written copy of the inquiry notification, the specific charges or areas of concern, and the name of the requesting authority. Those are my legal rights under the Military Medical Personnel Code, Section 14, Paragraph 3. She paused. I'll be in the waiting area. She walked past them down the corridor. Behind her, she heard Callum say something low that she didn't catch. She kept walking. In the waiting area, the same beige chairs, the same outdated magazines. She sat down and looked at her hands and allowed herself exactly 45 seconds of something that wasn't quite fear, but lived in the same neighborhood. She had known this was a possibility. She had known it from the moment she administered the compound. And she had done it anyway, and she stood by the decision, and none of those things made the next part easier. The Standards Board had the authority to revoke her nursing license. She sat with that for the 45 seconds she had allotted. Then she opened her notebook and began writing again, because her notes were the only thing she had that was incontrovertible, and she intended to make them more incontrovertible still before anyone saw them officially. She was 3 pages in when her phone buzzed on the seat beside her. Unknown number. She almost ignored it. She picked it up instead. "Marsh," she said. A pause. Then a voice she didn't recognize, that male, low, careful in the way of someone speaking in a place where they weren't certain who could hear them. "I was on the Dravkin mission," the voice said. "I was the comms specialist on Calloway's team. My name is Rook. I got separated during the extraction. I've been off-grid for 36 hours. She went very still. "I need to talk to someone who isn't inside the base command structure," Rook said. "Calloway trusts you. I know who you are." "How?" "Because he said your name when they told him the rest of us were dead. That's how." A pause. "I know who fed our position. I have evidence. Physical evidence, not just testimony. Documents I pulled from a relay station during the withdrawal. But I need—" The line crackled. "I need someone on the inside of that hospital to help me verify the chain of custody before I bring it up the chain of command. Because the chain of command is exactly where the problem is." She looked at the door of the waiting area. Down the corridor, somewhere behind those closed double doors, Rowan Calloway was lying in a recovery room with a chest wound and a heart that had stopped and started again, and a floor nurse who was good but didn't know what she didn't know. And someone, somewhere in the chain of command that this stranger on the phone was warning her about, had just filed an inquiry with the Standards Board. The timing was not a coincidence. She had stopped believing in coincidences approximately 14 years ago. "Where are you?" she said. "Don't answer that yet," she said, not to Rook but to herself. 1 second of friction before she committed to a direction she couldn't walk back from. Then she said, "Keep talking." Rook's voice was controlled but not calm. There was a difference, and she had learned to hear it. Controlled meant he was managing something. Calm meant there was nothing to manage. He was doing the former, which meant the situation was exactly as bad as he was presenting it, without exaggeration, because people who exaggerated tended toward calm in their delivery, performing the drama rather than suppressing it. "I'm at a fuel depot 12 kilometers east of the base perimeter," he said. "Civilian use, unmanned overnight. I've been here since 0300. Are you injured?" A pause. "Frostbite, left hand, minor. I took a graze on my left side during the withdrawal. It's not deep, but it's been 36 hours and I haven't been able to clean it properly. You need medical attention. I need to not walk into that base through the front gate before I know who's waiting for me," he said. "That's the priority." She thought about this quickly and practically, the way she thought about triage, what was immediate, what was secondary, what would cascade if left unaddressed. A wound untreated for 36 hours in field conditions was not automatically critical, but it was not nothing. Frostbite on the left hand depended on grade. He'd said minor, which either meant minor or meant he'd assessed it wrong because he was running on adrenaline and tunnel vision and hadn't properly looked. "The documents you mentioned," she said. "What are they?" "Mission routing records from the relay station at grid reference Delta 7. Paper copies. The station runs analog backup for exactly this kind of situation, when someone wants to pull a record without leaving a digital footprint." His voice dropped half a register. "Somebody accessed that station 4 days before the Dravkin extraction, made handwritten amendments to the routing brief. I found the original draft underneath the amended copy. They'd been filed together by accident. Or carelessness. The amendments redirect our extraction path through the exact coordinates where the ambush was positioned." She closed her eyes for 2 seconds, opened them. "The handwriting," she said. "Did you photograph it?" "I have the physical documents." "Good. Don't photograph them. Don't digitize them. Paper chain of custody is cleaner if this goes to tribunal." She was already standing, moving toward the window, putting distance between herself and the door on instinct. "You said the problem is in the chain of command. How specific is your concern?" "Specific enough that I'm calling a nurse instead of my commanding officer," he said. "Calloway's CO is Colonel Fenn Draker. Mission planning for Dravkin ran through Draker's office." The name landed flat and heavy. She knew the name. She'd seen it in the planning archive, the one she'd accessed informally, the one that had shown her the routing discrepancy. Draker's authorization signature was on the final mission brief. She had noted it without acting on it because an authorization signature proved presence in a process, not manipulation of one. But a handwritten amendment to the routing brief, in Draker's handwriting, redirecting Calloway's team into the kill zone. That wasn't presence. That was authorship. Stay where you are, she said. Don't use your primary phone after this call. Do you have a secondary? Yes. Text me the number and then pull the battery on the primary. She hesitated. One more calculation, fast and uncomfortable. I'm going to need 2 hours. I've been here 36, Rook said. 2 hours is manageable. The line went dead. She stood at the window and looked at the landing pads below, and thought about the specific geometry of what she was holding. A patient in a recovery room who was stable but not safe. A standards board inquiry designed to discredit her before she could testify to anything. A comms specialist hiding in a fuel depot with physical evidence of a command-level betrayal, and a nursing license that might not survive the next 72 hours. She thought about Calloway saying 5 of them knew we were coming. She thought about 5 soldiers who were not in recovery rooms. She turned away from the window and walked back to the door, and she went to find Vaith. She found him in the staff corridor outside the surgical prep area, which was the place she had learned he went when he needed to think, because it was almost always empty between procedures. I was leaning against the wall with a cup of coffee going cold in his hand, reading something on his phone, and he looked up when he heard her coming. One look at her face, and he straightened. What happened? I need to tell you something, she said, and I need you to hear all of it before you decide what to do with it, because the decision matters, and you don't have all the information until I finish. All right, he said. She told him. Not everything. Not Rook's name, not the depot location, not the specific details that needed to stay contained. But enough. The routing discrepancy she'd found in the planning archive, the standards board inquiry and its timing, the call she'd received from a survivor who was not inside the base because he had reason not to be. Vaith listened without interrupting, which she had not entirely expected. When she finished, he was quiet for a moment. Then, you accessed a classified archive. Informally. That's the second time you've used that word. It's accurate both times. He looked at his coffee. If this goes to a military investigation, a real one, not a standards board performance, your archive access is going to be part of the record. I know. I know, she said again. I know what it could cost me. I'm asking if you'll help me anyway. He looked at her. The particular look of someone doing a fast, honest accounting of what they were willing to stake on another person's judgment. What do you need? He said. I need Calloway moved. Vaith blinked. He's 18 hours post-op. I know his condition. I need him in a room that isn't on the standard floor assignment, under a different patient identification tag, accessible only to you and Okafor. If someone inside this base is connected to the mission failure and they become aware that their survivor is talking, she let the logic finish itself. It did. Vaith set his coffee down on the windowsill. That's a significant operational ask for a nurse on a suspended consultancy. Yes. If I do this and you're wrong, then you moved a post-op patient for a non-clinical reason, and you'll have to account for that to Callum, she said. If I'm right and you don't, you'll have to account for something worse. A long pause. Give me 40 minutes, he said. The 40 minutes were the hardest kind. The kind where she had nothing to do but wait and thinking without action was its own particular misery. She used the time to write. Not notes, a formal statement, addressed to the JAG office, documenting the timeline of her involvement from the moment she'd seen the deployment notification to the moment she'd administered the compound on the helicopter. Every decision, every data point, every piece of reasoning. She wrote it with the care of someone building something that needed to hold weight because it was going to hold weight. She was on the 4th page when her secondary phone, the one she'd bought at the base commissary 2 years ago and kept charged out of a habit she couldn't quite justify until now, buzzed with a text from an unknown number. Still here. Left hand is worse than I said. Not critical, but you should know. She read it twice. Frostbite progression. Grade 2, probably. If he was acknowledging it had worsened. The timeline was still manageable, but the margin was narrowing. She typed back, 60 more minutes. Hold. She put the phone down and finished the 4th page. Vaith appeared at 1 hour and 3 minutes. Not 40, because nothing in this building operated on its stated timeline. And he sat down across from her with the expression of someone who had just done something they could not undo. He's in room 7 on the surgical recovery annex, Vaith said. It's technically a post-op monitoring room, not a patient room, so it doesn't appear in the standard bed registry. I've listed him as a complex surgical observation case under my direct management. He paused. Okafor is not happy about this. Is he doing it anyway? He's doing it anyway. Veith looked at her. Calloway was awake when we moved him. I told him it was a precautionary measure. What did he say? He said, and I'm quoting, "Tell her she has my phone and I need it back." Despite everything, something in her chest loosened slightly. She hadn't realized it had been tight. He can have it back when his pressure holds above 60 for 4 consecutive hours, she said. Veith almost smiled. Almost. The Standards Board inquiry notification came through officially about 20 minutes ago. Graft filed the formal request. You have 5 days to respond with documentation. 5 days, she said. It's not much time. It's enough. She stood. I need to leave the base for approximately 3 hours. I need my access badge to still work when I come back. Veith stared at her. I can't guarantee that. If Callum processes the suspension, then I'll find another way back in. She picked up her bag. But I need you to not actively facilitate the suspension. Can you do that? He was quiet for a moment. Then, I have a meeting with the deputy director at 2 p.m. that I can make last as long as necessary. Thank you, she said. Don't thank me, he said, exactly the way Whitfield had said it the morning before. And she wondered if that was something they taught here, or something the building did to people over time. She left through the East Service exit, which was the exit she'd identified on her first day in any hospital or base facility as a matter of long habit. The exit that wasn't the front entrance, wasn't monitored by the primary security desk, and could be reached without passing through any of the floors where the people who might stop her were most likely to be. The cold outside was physical and immediate, a full step down from the climate-controlled interior, and she pulled her jacket tighter and walked toward the vehicle pool, where she had a rental car from her original transport authorization that technically no one had revoked yet, because the administrative machinery of suspension moves slower than the human beings navigating around it. She drove east. The fuel depot was exactly where Rook had described it, a low corrugated metal structure set back from a service road, surrounded by frozen ground and the skeletal shapes of dormant equipment. There were no vehicles, no lights, nothing moving. She parked 40 meters back and sat for 2 minutes watching before she got out. She found him inside, in the far corner behind a shelving unit, sitting on an equipment crate with his back to the wall and his right hand resting on something at his hip that she was fairly certain was a sidearm. He was younger than she'd expected from his voice, late 20s, dark-skinned, with the specific weathered quality of someone who'd been operating outdoors in extreme cold for too long. His left hand was wrapped in what appeared to be torn fabric from his jacket lining. He looked at her. She looked at him. You came alone, he said. Yes. That's either very trusting or very strategic. Both, she said. Those aren't mutually exclusive. She set her bag down and crossed to him and said, Left hand, let me see. He extended it without argument, which told her he was in more discomfort than his voice had communicated. She unwrapped the fabric and looked at the hand in the low light from the single overhead fixture. The skin on the tips of his index and middle fingers was blistered and waxy white with a darker edge, and the tissue had the particular stiffness of grade 2 frostbite in the rewarming window. This needs proper treatment, she said. I know. Not critical, but the next 6 hours matter. She was already opening her bag, pulling out the kit she carried as a matter of established habit that had been useful more times than she could count. I'm going to start rewarming. It's going to hurt. I know, he said again. It did. He breathed through it without making a sound, which cost him something. She could see it in the set of his jaw and the controlled exhale he allowed himself every 30 seconds. And she found herself respecting him for it in the practical, unsentimental way she respected competence. While she worked, he reached into the inside pocket of his jacket with his right hand and withdrew a folded envelope. The documents, he said. She looked at them but didn't take them yet. Tell me the chain of custody from the moment you found them, he told her. It took 4 minutes and was completely coherent. The relay station, the filing error, the moment he'd recognized what he was holding, the decision to take them rather than leave them. He had not opened the envelope after sealing it. He had not photographed the documents. He had not told anyone else. She took the envelope. She held it for a moment, feeling the weight of it. Not heavy, 3 or 4 pages at most, the kind of weight that was entirely disproportionate to its physical mass. If this is what you say it is, she said carefully, then this goes to JAG. Not to Calloway's command, not to base administration. Directly to JAG, with a full statement from you and a documented chain of custody. I know the protocol, Rook said. The person who filed the Standards Board inquiry against me this morning, I believe it's connected. I believe someone in base administration was tipped off that Calloway was alive and talking, and the inquiry is designed to discredit the testimony of the person closest to him before any investigation can get traction. Rook looked at her steadily. How sure are you? Sure enough to have driven here alone, she said, not certain enough to guarantee what happens next. He nodded slowly. What do you need from me? Your formal statement, your name on record, and your willingness to walk into the JAG office at Coldwater Station in the next 24 hours. She paused. I know what I'm asking. You're asking me to trust a process that I've got good reason not to trust, he said. I'm asking you to make the evidence too loud to ignore, she said. There's a difference. He looked at the envelope in her hands. Then he looked at her. Not the look she was used to. Not the look that assessed and dismissed. The look of someone deciding whether another person was the real thing. Calloway said your name, he said. When they told him the rest of us were gone, that was the first thing he said. She held the envelope carefully, the way you held something that could break in either direction. I know, she said. She drove back to the base with the envelope in her bag, and Rook following 20 minutes behind her in a vehicle she'd arranged with 2 phone calls, and she was 3 kilometers from the base perimeter when her phone rang. Veith, she answered. The meeting with Callum finished early, he said. His voice was wrong, tight in the specific way of someone delivering information they had not anticipated delivering. How early? She processed the suspension 20 minutes ago. Your access badge was deactivated at 1:47 p.m. She looked at the base perimeter ahead of her, the gate, the guard station, the buildings behind it, where Calloway was in a room that didn't appear in the bed registry. There's something else, Veith said. She waited. 2 men arrived at the base 40 minutes ago. Military intelligence, both of them. They're not here for the Standards Board inquiry. He paused. They're asking for access to Captain Calloway. The car moved. The gate got closer. Veith, she said, don't let them in that room. On what authority? Yours, she said. Your patient, your surgical case, your call. You are his physician of record, and you determine access based on clinical status. Her voice was very level. He is not stable enough for questioning. That is your professional assessment, and it is accurate. A pause that lasted exactly as long as a person needed to decide something they couldn't take back. He's not stable enough for questioning, Veith said. No, she said, he's not. She hung up. She was at the gate now, slowing, reaching for her badge on instinct before remembering it was dead, and the guard was already stepping out of the booth. And behind her in the rear-view mirror she could see Rook's vehicle appearing at the far end of the service road, and inside the base somewhere 2 men from military intelligence were standing outside a room that didn't appear in any registry, looking for a patient who was alive when he wasn't supposed to be. The guard reached her window. She looked at him. In her bag, 3 pages of handwritten routing amendments sat in a sealed envelope that connected a senior officer to 5 dead soldiers and 1 near-dead one. Your badge isn't reading, the guard said. I know, she said. I need to speak with the JAG officer on duty. My name is Sylvie Marsh, and I have evidence related to an active military incident that needs to be in secured custody in the next 30 minutes. The guard looked at her. The gate stayed closed, and from somewhere inside the base, her secondary phone buzzed once in her bag, a text from a number she recognized as Calloway's, which meant Veith had given him the phone back, which meant something had changed in that room, and she didn't know yet whether it had changed toward better or toward catastrophically worse. The guard's name was Specialist Dent, and he was 24 years old and had been on gate duty for 11 months and had never once been in a situation that wasn't covered by the laminated protocol card clipped to the inside of his booth. He looked at Sylvie's dead badge. He looked at her face. He looked at the protocol card. Ma'am, without active credentials, I can't. JAG officer on duty, she said again. That's all I'm asking. Call the JAG office and tell them Sylvie Marsh is at the East Gate with evidence related to the Dravkin extraction incident. Those specific words. Can you do that? He hesitated in the way of someone who genuinely wanted to do the right thing and wasn't certain which thing that was. Please, she said. not desperately, flatly. The pleas of someone who had used every other register and was now simply being direct. He went back to the booth and picked up the phone. She waited. Behind her, she could see Rook's vehicle parked on the service road shoulder, engine off, waiting with the particular stillness of someone who understood that moving right now would be the wrong decision. She checked her secondary phone. Calloway's text read, "Two men outside the annex. Vaith is stalling. How long do you need?" She typed back, "Working on it." Then she thought for a second and added, "Stay in the bed. Do not get up." 3 seconds later, "Pressure is 61. She almost laughed. She did not laugh. She put the phone in her jacket pocket and looked at the gate and waited. Dent came back out. His expression had shifted. Something had happened on the phone that had rearranged his understanding of the situation, and he was working out how to present the rearrangement. "The JAG duty officer is Captain Yael Stroud," he said. She said she'll come to the gate." "Thank you," Sylvie said. She pulled forward and parked on the verge inside the gate perimeter, which was technically not cleared but which Dent did not object to, and she got out and stood in the cold with her bag and waited for 3 minutes and 40 seconds before a vehicle came down the interior road and stopped. Captain Yael Stroud was 40, trim, with the particular economy of motion of someone who had learned a long time ago that physical stillness communicated authority more effectively than most other things. She was in uniform and had clearly come from a desk. She had a legal pad under one arm and a pen tucked behind her ear, and the expression of someone who had heard something on the phone that they were actively deciding how to categorize. She looked at Sylvie. "You said Dravkin extraction," she said. "Yes. That incident is currently under a preliminary MI review." "I know," Sylvie said. "The 2 military intelligence officers who arrived 40 minutes ago. I know who sent them, and I know why the timing matters." She reached into her bag and withdrew the envelope. "I have physical documents establishing that the mission routing brief for the Dravkin extraction was manually amended 4 days before the operation by someone with Level 4 planning access. The amendments redirected Captain Calloway's team through the ambush coordinates. I have a witness who retrieved these documents from the Delta 7 relay station during his withdrawal from the engagement zone, and that witness is currently in a vehicle on the service road outside this perimeter, willing to give a formal statement." Stroud looked at the envelope. She did not take it. Not yet, she was thinking, which Sylvie respected. "The Standards Board inquiry filed against you this morning," Stroud said. "Yes." "You think it's connected?" "The inquiry was filed approximately 6 hours after Captain Calloway regained consciousness and spoke to me. The timing is consistent with someone inside base administration attempting to discredit my testimony before any formal investigation could use it." She held the envelope steady. "I'm not asking you to take my word for any of this. I'm asking you to take the evidence and evaluate it independently." Another pause. Stroud was running the same calculation Veith had run, the same one Rook had run, measuring the cost of acting against the cost of not acting, weighing the risk of being wrong against the risk of being complicit. She took the envelope. "I need a formal statement from you," Stroud said, "and from the witness." "Agreed." "And your archive access." "I'll disclose everything," Sylvie said, "completely and on record. I accessed a planning archive through a login that wasn't properly deactivated on my reassignment. I found a routing discrepancy that led me to conclude the mission had been compromised internally. I'll document every step." "That disclosure could be used against you." "I know," Sylvie said. "Do it anyway." Stroud looked at her for a moment with an expression that was not quite respect but was something close to it. The expression of someone recognizing a person who had done their accounting and was standing in the result of it. "Get your witness," she said. The next 4 hours were the administrative machinery of truth. Unglamorous, painstaking, and conducted in a conference room with bad lighting and a coffee maker that produced something technically classifiable as coffee. Sylvie gave her statement first. 3 hours of it, recorded and transcribed by a young specialist named Peel, who typed with the focused intensity of someone who understood they were typing something that was going to matter. She told it in order, chronologically, without editorializing. And when she reached the parts that implicated her own access of the planning archive, she stated them flatly and moved on, because she had decided before she walked into the room that partial honesty was worse than none, and she was not interested in partial. Rook gave his statement separately in an adjacent room, and she could hear the murmur of his voice through the wall without making out the words. He had been given medical attention by the base corpsman before the statement began. Not proper care, not what she would have arranged, but adequate for the immediate window, which was all she had been able to negotiate from the gate. She had not been allowed to see Calloway. This was the part that sat in her chest during the 4 hours of testimony, not anxiously, but persistently, like a stone in a shoe that you couldn't stop being aware of. Veth was there. Okafor was there. The MI officers had been formally asked to stand down pending the JAG review, which they had done with the specific reluctant compliance of people who were waiting for a phone call that would change the instruction. She didn't know who they would call. She didn't know whether the call would come before or after Stroud opened that envelope. She found out at hour 4 when Stroud walked back into the room and sat down across from her and put the envelope, open now, the documents laid flat in their protective sleeves, on the table between them. The handwriting analysis will take 48 hours for formal confirmation, Stroud said. But I've had 2 people in this office look at the documents against Colonel Draker's signature on file, and the preliminary assessment is consistent. The name, spoken officially in this room, had a different weight than it had carried in Rook's voice from a fuel depot. Has he been notified? Sylvie asked. His movements are currently being monitored. He has not been informed of this inquiry. Stroud looked at her steadily. This is now an active investigation. That means you are a material witness, and your access situation at Coldwater Station is temporarily suspended, not by the Standards Board inquiry, but by JAG, which supersedes it. You'll be housed on base for the duration. Calloway. Captain Calloway is being moved to a secure recovery room under JAG protective protocols. Dr. Veith will continue as his physician of record. Stroud paused. He's been briefed on the investigation status. How did he take it? For the first time, something shifted in Stroud's expression. Not amusement exactly, but adjacent. He asked if you were in the building. What did you tell him? I told him you were giving a statement. She straightened the documents. He said to tell you the pressure is 63. She slept for 5 hours on a cot in a room that had been a supply closet and still smelled faintly of cleaning supplies, which was fine. She had slept in worse places. She woke at 6 a.m. to a base that felt different, not visibly, not in any way she could have pointed to, but the difference was there in the way a room feels different when the weather has changed outside even though the windows are closed. Veith was waiting in the corridor. Calloway had a rough night, he said. Blood pressure dropped around 0200. Nothing critical, but Okafor was with him for 2 hours. The compound interaction with the analgesic he's on. I know, we adjusted. He's stable now. He looked at her. He's asking to see you. Has Stroud cleared that? She cleared 15 minutes of clinical consultation. Sylvie went. Calloway was in a different room than before, smaller, no window, the particular sparse functionality of a space that had been set up for a specific purpose rather than comfort. He was more upright than she'd last seen him, and the gray had retreated slightly from his face, replaced by something that looked more like the person she had known, which was both better and more complicated. He looked at her when she came in. You got in, he said. Jag cleared me. I heard. He shifted slightly, winced, stopped shifting. Draker. Don't. You need to maintain adequate blood pressure for the next 48 hours, she said. The investigation will proceed without your active participation. He killed my people, Sylvie. The words sat in the room. She let them sit. I know, she said. He routed us into that position specifically. He knew the timing. He knew the approach. Calloway stopped. Breathed. The monitor ticked steadily. I served under him for 2 years. I trusted his operational assessments. I know. How do you say that so quietly? She looked at him. Because being loud about it doesn't change what happened. And because you being upset right now is going to drop your pressure again, which means Okafor comes back in here and I get removed from the room. She paused. So I need you to be angry more quietly. He looked at her for a long moment. Then something in his face, not the anger that didn't go anywhere, but the expression around it, shifted. You drove to a fuel depot alone, he said. Yes. With a sealed envelope of classified documents in your bag. Also, yes. He stopped. That was either very brave or very stupid. Both, she said. Those aren't mutually exclusive, he finished. A pause. You said that to me once before, 7 years ago. I say it a lot, she said. It keeps being true. He was quiet for a moment. The monitor beeped. Somewhere in the corridor outside, she could hear movement. The base coming to life at 0630, people arriving for shifts, the day beginning in all its ordinary machinery. "The 5 soldiers from my team," Calloway said. His voice was different now. Not the controlled anger of a moment ago, something rawer, something that cost more to say. "Rook was the only one who made it out." "Yes." "He's giving testimony." "He already gave it, last night. Will it be enough?" She thought about the documents in their protective sleeves on Stroud's conference table, about the handwriting analysis that was going to take 48 hours, about the MI officers who had been asked to stand down and were presumably making phone calls to whoever had sent them. "It's going to have to be," she said. Bum. The handwriting analysis came back in 31 hours, not 48, because Stroud pushed it, and because one of the analysts owed Stroud a professional debt she was willing to call in. The result was a 94.7% probability of authorship match between the routing amendments and Colonel Fendraker's documented handwriting samples. Sylvie was in the corridor outside Calloway's room when Stroud told her. She received the information and said, "What happens now?" "Now I brief the base commander," Stroud said, "and then I brief up the chain until this lands with the people who have authority to act on it." "How long?" "Hours, not days," Stroud said. "This isn't a complicated evidentiary picture. It's a clear chain, documented amendment, handwriting confirmation, witness testimony, placing the amendment in the context of the ambush outcome, signals intelligence that Rook flagged in his statement that we're now cross-referencing." She paused. "What takes time is the politics. Draker has been in this command structure for 14 years. People who've worked with him for 14 years don't accept this kind of conclusion without resistance." "The MI officers who came for Calloway," Sylvie said. "Who sent them?" Stroud looked at her. It was a careful look. "That's part of what we're establishing. But you have a direction." "I have several directions," Stroud said. "Some of them are more concerning than others." She picked up her legal pad. "Don't go anywhere." The instruction was unnecessary. Sylvie's bag was in the supply closet room and her badge was still in JAG custody, and she had approximately nowhere to go. She went back to the corridor and sat down in a chair that someone had placed there at some point, and she looked at the door of Calloway's room and thought about the particular kind of waiting that wasn't passive, the waiting that was its own form of work, holding the line while other processes moved. At 9:47 a.m., she heard voices from the far end of the corridor. She looked up. Colonel Dara Whitfield was walking toward her with Stroud on one side and a man she didn't recognize on the other. Older, civilian clothes. The kind of deliberately unremarkable presentation that people in specific intelligence roles cultivated deliberately. Behind them, 2 MPs. Whitfield stopped in front of Sylvie. "Colonel Draker's office has been secured," Whitfield said. Her voice was the same measured instrument it had been in the conference room 2 days ago, but something underneath it was different. Something that might have been controlled fury if Whitfield was the kind of person who allowed that. "He's been placed in restricted quarters pending formal charges." Sylvie looked at her. "He was in a meeting with the base logistics coordinator when the MPs arrived," Whitfield continued. "He didn't say anything, which is—" She stopped. "Which is noted." The man in civilian clothes was looking at Sylvie with an expression she didn't have a clear category for. "You accessed the mission planning archive," he said. Not an accusation, a statement, delivered with the flatness of someone who had already moved past the fact of it to its implications. "Yes," she said, "using a login that wasn't deactivated." "Yes." "The login belonged to a personnel record flagged under operational security seal," he said, "which means your reassignment records from the Crestfall posting aren't simply administrative. They're classified above the level of anyone in this building, including Colonel Whitfield." He paused. "Which means you had access to that archive not because of an administrative oversight, but because whoever sealed your records left the access intentionally active." The corridor was very quiet. "I wasn't aware of that," she said carefully. "No," he said. "You wouldn't have been." He looked at Stroud. "We're going to need a separate conversation about Ms. Marsh's Crestfall records before the formal inquiry proceeds." Whitfield looked at Sylvie. "Is there something about your prior posting that's relevant to this investigation?" She thought about Calloway saying her name in the helicopter. She thought about Ironvale and what it had meant 7 years ago, in a forward operating position that no longer appeared on official maps. "Potentially," she said. It was the most honest answer she had. Yeah. The separate conversation happened in Stroud's office, with the door closed and the man from outside the building. His name, eventually, was Harwick, and he was from a branch of military intelligence that Sylvie had heard of once and never expected to encounter, asking questions that confirmed methodically what she had suspected since the corridor conversation. Her Crestfall records weren't sealed because of standard operational security. They were sealed because of what she had witnessed there. The Crestfall posting, 18 months, the hardest terrain she'd ever served in. She had thought she remembered it clearly. She did remember the medicine, the protocols, the development of the compound that had been dismissed and set aside. She remembered the cold and the altitude and the particular isolation of working that far from anything that resembled normal command structure. What she had not fully processed, because she had been 29 and focused on the clinical work, and because the full context had only become visible in retrospect, was that the operational mission running alongside the medical unit she'd served with had been gathering intelligence on a network of internal military compromise that had been suspected for years and never conclusively established. Calloway had been part of that operational mission. She had known him as a soldier in a difficult posting. She had not known, had been specifically not told, that his presence there was part of a longer intelligence effort. Draker was flagged during the Crestfall period, Harwick said. He was looking at her with the particular neutrality of someone delivering information they had withheld for reasons they considered adequate and were now reassessing. His financial records showed anomalies consistent with foreign payment. The evidence at that stage was insufficient for formal action, and the decision was made to continue monitoring. While he continued to have operational command authority, she said. Yes. Over teams that included Captain Calloway. Among others. Harwick's expression shifted by a fraction. The Dravkin mission was not random. Calloway's team had been tasked with a secondary intelligence objective that Draker was aware of, the retrieval of communications equipment from a compromised relay position. Equipment that, if recovered intact, would have directly implicated the network Draker was working with. She sat with this. He sent them in to die, she said. Not to compromise the mission, to eliminate the team that was going to complete it. That's the current working conclusion, yes. She looked at the table, at her hands on the table, at the small scar on her right index finger from a field suture she'd done herself in year 2 of her posting, the needle slightly too large for the job because it was what she had. The 5 soldiers who died, she said, they were targeted specifically. Calloway's team was specifically selected for the objective because of their clearance levels and prior reliability. Draker selected them, and then he compromised them. The silence that followed was not comfortable. She didn't try to make it comfortable. The Standards Board inquiry, she said. Who filed it? Harwick looked at Stroud. Stroud said, the request originated from an administrative contact inside the base logistics structure. We're establishing the connection to Draker's network, but the preliminary evidence suggests it was filed on instruction. Someone who knew Calloway had survived, and that you were close to him, and who acted to discredit you before you could become a formal witness. Someone in base logistics, Sylvie said. A civilian contractor with base access, Stroud said. He's been identified and his access has been suspended. She absorbed this. The geometry of it was completing itself now, not cleanly, not the way things completed themselves in the kind of stories where everything resolved into a satisfying shape. More like the way a fracture appeared in an X-ray. The break was there. You could trace the line of it, and the line showed you both where the damage was and how it had spread. My nursing license, she said. The Standards Board inquiry will be formally withdrawn, Stroud said. Once the connection to the compromised network is established in the evidentiary record, the inquiry is nullified under Military Justice Code as a bad faith filing. And my clinical documentation, the compound protocol, that, Harwick said, is outside my jurisdiction. He said it without apology, which was the honest version of it. That goes back to the Standards Board through normal channels. With a case study attached, Stroud said. She looked at Sylvie. A case study involving a documented save in field conditions that wouldn't have been survivable without it. That's not nothing. No, Sylvie said. It's not. Draker was formally charged at 1400 hours. She was not in the room when it happened. She was in the corridor outside Calloway's room, which is where she had ended up after Harwick's office. After Stroud's careful summary of what would happen next and in what order, After the long walk back through a base that was still outwardly running on its normal rhythms, but that she could feel shifting underneath, the way ground shifted after water moved through it. Veith came out of Calloway's room and found her there. "Charges filed," he said. He had heard through the medical staff network, which was faster than most official channels in any facility she'd ever worked in. "Draker." He said the name with the flatness of someone who had been processing something for 30 hours and had arrived at the far side of the processing. I don't have a framework for this. 14 years in military medicine, and I don't have a framework for a commanding officer deliberately routing a team into an ambush." "Most people don't," she said. "That's not a failure of imagination. It's a reasonable assumption about the limits of what people do." He looked at her. "You didn't make that assumption." "I've seen what people do when money is involved," she said. "It's a different framework." He was quiet for a moment. Then, "The Standards Board inquiry is going to be withdrawn. Stroud told me. I want to go on record as a supporting witness for the compound protocol submission when it goes back to the board," he said. "I want my name on it. The case study, the field documentation, my clinical assessment of the outcome." He paused. "I should have looked at your original submission in 2021. I was on the review committee." She looked at him. "You voted against it," she said. It wasn't a question. She'd memorized the committee members the way she'd memorized everything connected to the rejection. "I abstained," he said, "which is different from voting against it, and also not meaningfully different from voting against it, because an abstention in that context was a vote for the status quo." He held her gaze. "I read it last night. The full submission. I should have read it in 2021. She thought about what to say to that. She had, over the years, developed a number of responses to this category of statement, ranging from the professional and measured to the things she actually felt, which she rarely said because they didn't serve any useful purpose, and because she had learned that bitterness was an expensive fuel that burned through things you needed. "You're reading it now," she said, "and you'll put your name on it." "Yes. That's what matters going forward." He nodded. He looked like he wanted to say something else and didn't have the words for it yet. She recognized that the gap between understanding something and having language for it was a real gap, and not everyone could close it quickly. "He's asking for you again," Veith said. He gestured toward Calloway's door. She went in. Calloway was sitting up straighter than he had been. The gray was almost gone from his face. He looked, for the first time since the helicopter, like a person who was primarily present in the room they were in, rather than in some adjacent space between here and wherever he'd nearly gone. "Draker's been charged," he said. "I know. Rook's testimony and the documents, and the handwriting analysis, and the signals intelligence cross-reference, and the financial records from the Crestfall monitoring period." She sat down in the chair beside the bed. "It's a thorough case." He looked at the ceiling for a moment. 5 soldiers, he said. Gareth Voss, Annika Prell, Marcus Dunbar, Theo Saywell, Lena Ferris. He said each name with the deliberateness of someone doing a thing that cost them something and doing it anyway. They had people. Ferris had 2 kids. She didn't say anything. "Draker came to Ferris's last birthday dinner," Calloway said. "That's what I keep thinking about that." He sat at the table. He shook hands with her husband, and he already knew. His jaw tightened. He already knew what he was going to do. The room was quiet for a moment. "When the trial happens," she said carefully, "that's going to be part of the record. Everything he knew and when he knew it. That's not nothing. It's not adequate, but it's not nothing." "No," he said, "it isn't." His hand was resting on top of the blanket. She looked at it and looked away. "How's the pressure?" she asked. 67, he said. "That's better." "Okafor said I can try standing tomorrow." "Okafor is optimistic," she said. "Let's aim for the day after." He almost smiled. It looked like it hurt, but in a different way than before. "You're still managing my recovery?" "Apparently." "What happens when JAG releases you?" She thought about Lakemore Regional Support Hospital, 200 miles from anywhere interesting, where her badge still read nursing, and her office had a window that looked at a parking lot, and her desk had a drawer full of revision notes for a protocol submission that the committee had returned to her 3 times. "I'll go back to my posting," she said. "And the compound protocol?" "Goes back to the Standards Board with a stronger submission than before." He looked at her. "Veith." "He's putting his name on it," Good. A pause. Sylvie. What? You said you had reason to believe my deployment carried elevated risk, he said, when you were asking for transport authorization. 6 days of asking before they cleared you. Yes. Was that about the routing discrepancy you found in the archive? She considered how to answer this. The true answer was layered. Yes, the routing, but also the deployment notification she shouldn't have seen, and the flag it had tripped in her memory of the crestfall period, and the specific quality of the unease she'd felt that had no single identifiable source, but was the sum of a dozen small things that didn't quite fit. Partly, she said. And the other part? She looked at him. I knew the mission parameters didn't add up for your team's capabilities. The objective was underscaled for the personnel assigned. You send a team like yours on a 40-minute extraction sweep, and something is either missing from the brief or wrong with the brief. Both possibilities were bad. You figured that out from transport documentation. And from knowing how you work, she said. 7 years is a long time, but some things don't change. He held her gaze for a moment. Something moved through his expression that she didn't have a precise word for. The name I said, he told her. On the helicopter. When I was... He stopped. Started again. Evie. Yes. I haven't called you that since the Crestfall posting, she said. I know. I didn't know I still had that in me, he said. That word, at that level. She looked at her hands. The scar on her index finger, the bitten down edge of her thumbnail that she'd been meaning to stop doing for about 6 years. You were somewhere very far away, she said. People reach for the things they're most sure of. He was quiet for a moment. Were you sure, he said, that I'd hear you? She thought about the compound in her hand on the helicopter, and Briggs moving the lead, and the specific quality of certainty she'd felt. Not that he would survive, but that if she said the right words in the right register at the right moment, some part of him that was further away than unconscious would respond to them. I was sure enough to try, she said. He looked at her for a long time. The monitor beeped steadily. 67, 68. There's something else, he said. His voice had shifted. Something in it she recognized. The careful register of a person approaching information they've been sitting with. What? Harwick was in here this morning, he said. Before you came in. She went still. He told me about the Crestfall intelligence operation, Calloway said. The full context. What my role in it was. What the objective was. He paused. And he told me something he hadn't told you yet. She waited. The financial records from the Crestfall monitoring period, Calloway said. The ones that flagged Draker. They were comprehensive. They covered his full network of contacts and payment recipients. He looked at her steadily. Sylvie, the network didn't just include Draker. The monitor beeped. The person who rejected your compound protocol submission in 2021, Calloway said. The committee chair. His name is on Draker's payment ledger. The room stayed exactly the same size it had been a moment ago, but it felt smaller. How long, she said. Harwick didn't know when the relationship started, but the rejection of your submission, the framing of it, the specific language used, it's consistent with an effort to keep that protocol out of active deployment. She thought about the protocol, about altitude-induced cardiac events, about what it would mean, specifically, operationally, to have a treatment that improves survival rates in exactly the conditions under which compromised missions were most likely to be run, about who benefited from soldiers not surviving. The clarity of it arrived not all at once but in steps, each one slightly sicker than the last. Harwick is coming back to talk to you, Calloway said. This afternoon. He said... He stopped. He said he needs to know everything you remember about the methodology review, who pushed back on which sections, who asked which questions. He held her gaze. The Standards Board inquiry isn't just connected to Draker's network, Sylvie. It's connected to the same financial pipeline that funded the Dravkin ambush. She looked at him. He looked at her. Outside the door, somewhere down the corridor of the base hospital, where she had arrived 3 days ago, without clearance or credentials or anyone's permission, the machinery of a formal military investigation was already moving, charges filed, evidence logged, a colonel in restricted quarters, a civilian contractor suspended, a JAG officer with a legal pad and the authority to pull on threads. She had pulled the first thread. She had not known, when she boarded the helicopter, how far it would unspool. The committee chair, she said. He still sits on the board. Yes, Calloway said. He's been sitting on it since 2021. Yes. She looked at the door, at the corridor beyond it, and the base beyond that, and the legal and institutional machinery that was currently moving, carefully, officially, with proper documentation, toward a man in restricted quarters, while a second man sat in a committee room at a standards board office somewhere with access to every future protocol submission she would ever make. Harwick said this afternoon, she said. 2 p.m., Calloway confirmed. She looked at her watch. It was 11:23 a.m. She had 2 hours and 37 minutes, and her access to the base's informal digital architecture was currently sitting in the evidence log, and Harwick was coming at 2 p.m. with questions about a methodology review that she needed to remember precisely and completely, and everything she thought she had understood about why her protocol had been rejected had just shifted into a darker and more specific shape. She picked up her notebook. She started writing. She wrote for 2 hours and 19 minutes without stopping. Not stream of consciousness, structure. Every committee session she could recall from the 2021 review, chronologically ordered. Every question that had been asked about her methodology and who had asked it, the specific language of the written rejection, which she had memorized not deliberately, but through the way significant disappointments embedded themselves, whether you wanted them to or not. The follow-up communications. The names attached to each objection. She had thought, when she memorized those names, that she was holding on to them as a form of witness. Someone should remember who said what, even if nothing ever came of it. She had not imagined she was building a document that would matter to a military intelligence investigation 4 years later. That was the thing about careful work. You didn't always know what it was for when you were doing it. Harwick arrived at 1:58 p.m., which told her something about him. He sat across from her in the same supply closet room with his own notepad, and he asked precise questions and she gave precise answers. And when she placed her written notes on the table between them, he read them with the focused attention of someone who had stopped being surprised by things a long time ago and had replaced surprise with thoroughness. The committee chair, she said, Brigadier Ellard Moss. Yes. His objections centered on 2 sections, she said, the altitude modification to the vasopressor ratio and the field synthesis methodology. Both objections were framed as insufficient clinical validation, but the specific questions he asked weren't about validation. They were about replicability. He wanted to know whether the compound could be produced outside a controlled laboratory environment. Harwick looked up from his notepad. He asked that explicitly. 3 times, in 3 different formulations, she said. At the time, I thought he was concerned about deployment logistics. Now I think he was establishing whether field units could produce it independently, whether it would require centralized supply chains he could influence. Harwick wrote something. Then he looked at her with the expression she had started to read as his version of gravity. Not theatrical, just the look of someone holding something heavy. Moss submitted his resignation from the standards board this morning, he said, before he was formally approached, which means he knew we were coming. She absorbed this. He still resigned under his own terms. He resigned before we could remove him, Harwick said. There's a difference legally, but the outcome for the board is the same. He's gone. His votes on pending submissions are under review, and his prior decisions, including the 2021 rejection of your protocol, are being audited for conflict of interest. She looked at the wall. At the faint outline where a shelf bracket had been removed, the screw holes still visible, patched but not painted. Audited, she said, not automatically reversed. No, Harwick said. The audit will take time. The board will need to reconvene with new membership for any formal reversal. I can't give you a timeline that's honest and specific at the same time. She nodded. She had known this, had known, coming into this room, that the resolution was not going to arrive in a clean package. It never did. The machinery of institutional acknowledgement moved slower than the events that warranted it, and you could either make peace with that or destroy yourself fighting the pace. She had made that peace a long time ago. It still required occasional renewal. What I can tell you, Harwick said, is that your protocol documentation, your case study from the Dravkin extraction, and Dr. Vaith's supporting statement have been formally entered into the JAG investigation record as material evidence in establishing the scope of harm caused by Moss's conflict of interest. He paused. That record is public once charges are filed. The medical community will have access to it. She looked at him. You're telling me the publication happens through the investigation record, she said. I'm telling you the evidence will be visible, he said carefully. What the medical community does with visible evidence is outside my jurisdiction. It was, she thought, the most useful thing anyone in a position of authority had said to her in 4 years. Draker's court-martial was set for 6 weeks out. Moss was charged separately: financial corruption, conflict of interest, obstruction of medical advancement under military personnel welfare statutes, a charge that Stroud had apparently argued for with some persistence, and that Sylvie had not known existed until she read it in the formal charging document. The civilian contractor who had filed the Standards Board inquiry on Draker's instruction received a separate charge of administrative fraud and lost his base access permanently. The network Harwick's office unraveled over the following weeks was not enormous. It was in fact disappointingly human in its scale. Not a vast conspiracy, but a small one. 3 people in a financial arrangement that had been running for 9 years, sustained by the ordinary institutional blindness of organizations that trusted their own structure more than they should. Draker had sold extraction routes and mission parameters. Moss had protected the medical protocols that might have improved survivor rates in the operations Draker was compromising. The contractor had handled the administrative interference, the kind of low-level obstruction that institutions ran on and rarely examined. 3 people, 9 years, 5 soldiers dead on a mountain. The smallness of it was its own specific horror. Sylvie thought about this during the week she spent at Coldwater Station, first under JAG witness protocols, and then, as the investigation solidified around the evidence rather than around her testimony, simply because she had been asked to stay available, and because Calloway was still in the recovery annex, and because leaving felt wrong in a way she didn't examine too carefully. She thought about it, and she wrote about it, not in her clinical notebook, but in a separate document she kept on her laptop, which was a thing she had never done before, and which she was not sure she would ever show to anyone. The writing was not elegant. It was the kind of writing that happened when you were working something out rather than communicating something you'd already resolved. And it was full of false starts, and abandoned sentences and observations that contradicted each other because the truth of it contradicted itself. The truth of it was that she had spent 14 years being ignored in rooms, and the ignoring had been so consistent and so complete that she had internalized it as a feature of the landscape rather than a choice made by specific people with specific interests. She had kept working because the work mattered and because she was not built to stop, but she had stopped expecting the work to be seen. The compound had been seen now, not because she'd fought harder or spoken louder or found the right language, but because circumstances had forced a situation where ignoring it would have cost someone a life in front of witnesses who couldn't look away. She was not sure how to feel about that. She was not sure she was supposed to feel clean about it. Calloway took his first real steps on day 11, not the corridor shuffle that Okafor had permitted on day 3, supervised in brief and technically classified as mobility assessment rather than ambulation. Real steps, from the bed to the window, 12 feet, without holding anything. She was in the room when he did it because she had learned his schedule well enough to be present for the attempts that mattered, and she stood near the door and watched him cover the 12 feet with the focused, ugly determination of a person forcing a body that wasn't ready to do a thing that used to be automatic. He made it to the window. He put one hand on the frame and looked out at the landing pads below. The same landing pad she had looked at from a different angle 11 days ago while she was waiting. He didn't say anything for a moment, then cold out. Yes, she said. How far is 12 feet in terms of... It's a start, she said. That's all it needs to be right now. He turned around. The turn was careful, not graceful, but controlled, which was the honest version of progress. He looked at her. Nerve damage in the right leg, he said. It wasn't new information. Okafor had told him on day 4, carefully and thoroughly, and Calloway had received it the way she would have expected him to, without drama, which was not the same as without cost. Okafor says partial, says it may improve with time and the right rehabilitation. May, she said. You're not going to soften it. No, she said. You don't need that from me. He looked at the floor between them. There are things I can't do anymore, he said. In the field. In the specific ways, yes. And I'm not reconciled to that yet. You don't have to be reconciled to it yet, she said. You have to be upright. The reconciling takes longer and you have time for it. He looked at her. You have a way of saying things, he said. I've had a lot of practice, she said, telling people hard things without making them smaller. He moved away from the window, back toward the bed, and she watched him cover the 12 feet in reverse with the same ugly, honest determination. He sat on the edge of the bed and breathed. The compound protocol, he said. Harwick told me about the audit. Yes. It could still take months. Yes. How are you with that? She thought about this genuinely rather than reaching for a composed answer. I'm not patient by nature, she said. I've built patience as a skill because the alternative was burning through things I needed. So, she paused. I'm managing. That's a very Sylvie answer. It's an accurate answer. He almost smiled. What do you do while you wait? I work, she said. I write up the full case study properly, not just for the board submission, but for the clinical literature. I talked to Veith about the post-operative applications of the modified protocol because altitude-induced complications don't only occur in extraction situations. I document everything that happened here in enough detail that the next person who submits something similar has a roadmap for what works and what doesn't. You're building the road while you walk it, he said. I've always done that, she said. The road doesn't come pre-built for people like me. You build it or you don't move. He held her gaze for a moment. Something in it that she had been carefully not categorizing because there were enough complex things in this building without adding another one. Harwick cleared my debrief yesterday, Calloway said. I can be transferred to the rehabilitation facility at Weston Base in 2 weeks. She registered the information. 2 weeks. That's good, she said. Weston has a strong neurological rehabilitation program. It's 6 hours from Lakemore, he said. She looked at him. I know where Lakemore is, she said carefully. I know you know. He looked at his hands on his knees. I'm not sure what I'm saying. I'm saying it's 6 hours, which is not the same as across the world. I'm saying the debrief is done and I can make phone calls now. I'm saying... He stopped. Started again with less construction and more honesty. You walked into a helicopter you had no clearance for and brought me back, and then you spent 2 weeks in a supply closet fighting an investigation that someone built to take you down. And I would like to know what happens to you next. I'm not asking for a commitment. I'm asking if you'll let me know. She looked at him. The window behind him showed the landing pads, the frozen ground, the edge of the Dravkin Range visible in the far distance on a clear day. Right now it was overcast, the mountains hidden, the sky the flat white of a day that hadn't decided what it was going to do. You can know, she said. He exhaled. Not the exhale of relief, the exhale of someone who had been holding something that they could now put down. The distinction mattered. The Military Medical Standards Board held an emergency session 4 weeks after Moss's resignation. The audit of his prior decisions had produced, as Harwick had predicted, a visible and damning record. 7 protocol submissions over 9 years that had been rejected on grounds. The auditors found inconsistent with the stated clinical standards, all of them connected by a thread. Survival rate improvements in high elevation, high stress operational environments. The kind of improvements that would have complicated the value of what Draker was selling. 7 submissions, 7 rejections, 7 researchers who had been told their work was insufficient. Sylvie's was the 8th. The emergency session was convened to address the audit findings and to establish a path for re-review of the affected submissions. She was not invited to attend. She found this out from Veith, who had been invited as a supporting clinical witness, and who called her from the hallway outside the session room with the specific energy of a person who had just sat through something significant and needed to debrief immediately. They voted, he said. Full panel, new membership, 3 external civilian clinicians brought in for independent assessment. A pause. Sylvie. What? They approved it. She was sitting at her desk in Lakemore, in the office with the window overlooking the parking lot, with the case study document open on her laptop, and a cup of cold coffee at her elbow, and the ordinary sounds of a support hospital running its ordinary day coming through the walls. She sat with the words for a moment. Full approval? She said. For clinical deployment in high-elevation operational environments, pending production review for formulary inclusion, Veith said, which is the manufacturing step, not a clinical step. That's a formality timeline, not an obstacle. His voice had something in it she hadn't heard from him before. They cited the Dravkin case study. They cited the post-operative monitoring data. They cited my statement. Another pause. One of the new panel members, she said, on the record, that the original rejection was a failure of the review process, not a failure of the submission. She closed her eyes. She sat in the chair in the office with the parking lot window, and she let that sentence exist for a moment without managing her response to it, without filing it into a category or turning it into action or building the next thing out of it. She just let it be there. A failure of the review process, not a failure of the submission. 14 years of work, 4 submissions, 3 rejections, 2 revisions, 1 approval that had come from the worst possible conditions in the most unlikely possible way. She was not clean about any of it. The compound was approved, but 5 soldiers were buried, and the road that led from here to there was not a road she would ever fully make her peace with. Approvals did not retroactively fix the years in which they didn't exist. Justice did not erase loss. It only ensured that the loss was not also wasted. She knew that. She had known it for a long time. But she also knew that the next extraction helicopter in a high-elevation theater that carried a patient with altitude-induced cardiac failure would have something on board that worked. That the next nurse or medic who stood over that patient would have a protocol with her name on it. That someone, somewhere, would be alive because of the work she had done in the years when nobody was watching and in the moment when everyone was. She opened her eyes. "Veeth," she said. "Yeah. Thank you for putting your name on it." A pause. "You did the work," he said. "Yes," she said. "And you put your name on it. Both things matter." After she hung up, she sat for a while in the ordinary afternoon of a support hospital that smelled like antiseptic and recycled air and the particular institutional sameness of every medical building she'd ever worked in. She looked at the parking lot. A medic was walking toward the entrance with his hands in his pockets and his head down against the wind, just a person going to work, not knowing that in a conference room 6 hours away, a panel had just put their signatures on something that would change what was possible in the worst moments of his job. That was how it worked. Not announcements, not ceremonies, not the moment of recognition that arrived with trumpets. Just a signature on a document, and then the document becoming real, and then the real thing saving someone who didn't know it was coming. She pulled her laptop toward her and opened the case study document and kept writing. Draker was convicted 11 weeks after his arrest. The court-martial lasted 4 days, which was short for the weight of what it covered. The conviction included dereliction of duty, willful endangerment of military personnel, and conspiracy charges connected to the foreign financial network. The sentence was 22 years at a military correctional facility, the forfeiture of all rank and benefits, and the permanent revocation of his security clearance. The sentence was read aloud in a room Sylvie was not present in. She heard about it from Rook, who had attended as a witness and who sent her a text message that said simply, "Done. 22 years. The 5 have their answer." She read it standing outside the Lakemore Pharmacy waiting for a supply order, in the middle of an ordinary Tuesday, and she stood there for a moment in the cold and thought about Gareth Voss and Annika Prell and Marcus Dunbar and Theo Saywell and Lena Ferris, whose names she had heard once from Callaway and had not forgotten because she was not built to forget the names of people who deserved to be remembered. 22 years was not adequate. She knew that. Adequate did not exist in this category. But inadequate was not the same as nothing, and nothing was what accountability looked like when systems protected themselves. And systems had not protected themselves here because a comms specialist had grabbed paper documents from a relay station and a nurse with a worn bag and a suspended badge had driven to a fuel depot alone. Small things. The world changed in small things. Moss entered a plea agreement 2 weeks after Draker's conviction. 7 years, reduced from the potential 12, in exchange for full cooperation with the ongoing network investigation. His resignation from the Standards Board had not spared him the rest of it, which Sylvie thought was right, and then thought about whether it was her place to think it was right, and then decided that she had spent enough years not allowing herself opinions about things that had directly shaped her life. It was right. He had used a position of authority to protect a financial interest at the cost of clinical advancement and operational safety, and he had done it for 9 years. And 7 years was a consequence that at least had the shape of one. She was in her office on a Friday afternoon in late spring when Callaway called. She knew his voice in the first syllable, which was not something she examined. Weston cleared me for the next phase, he said. They're recommending outpatient rehabilitation going forward. A pause. I have a daughter. She's 6. Her name is Mara, and she's been staying with her grandmother in Ashford Harbor while this has been happening. I know, she said. You mentioned her once. You were half asleep and your pressure was 61, and you told me she liked blue things. A silence. I don't remember that, he said. You wouldn't, she said. You were at 61. Blue things, he said. She could hear something in his voice that was the sound of a person recalibrating around a piece of information they hadn't known they'd given. Yeah, everything has to be blue. The blanket in your recovery room, she said. It was a blue blanket. I picked that one. Another silence, longer. Sylvie. What? I'm going to Ashford Harbor, he said. I'm going to be there for a while, probably. Long rehabilitation timeline, and Mara is there, and it's where I need to be. A pause. It's about 4 hours from Lakemore. That's closer than Weston, she said. Yes, he said. It is. She looked at the parking lot window. The late afternoon light was doing something specific to the parked cars, catching the edges of them, making ordinary metal look briefly significant. She had always noticed things like that, and never known what to do with the noticing except file it away. I'd like to visit, she said, at some point, when you're settled and when Mara is adjusted and when it's not logistically complicated. It won't be complicated, he said. You don't know that yet. No, he said, but I know you drove to a fuel depot alone, so I'm not worried about complicated. She looked at the case study document on her laptop. 87 pages, complete, ready for submission to the Military Medical Journal. Veith had reviewed the final draft and signed off that morning. The protocol's name, in the formal submission, was listed under her full name, Marsh Altitude Cardiac Protocol, developed S. Marsh, RN, Crestfall Mountain Division, 2019 to 2021, and the name sat on the page in the same font as everything else, not larger, not emphasized, just there, real, on the record, permanent. Calloway, she said. Yeah. Go be with your daughter, she said. I'll find you in Ashford Harbor. She heard him exhale. The same exhale as before, the one of something put down rather than something released, because putting down was the honest version and releasing implied it was gone, and nothing that had happened in the last several months was gone. It was carried. It would be carried. But carried was different from crushed under. She submitted the case study at 4:47 p.m. She closed her laptop. She sat in the office with the parking lot window for a few minutes, doing nothing, which was something she was not naturally good at, and had been practicing, because the things she had learned, slowly, imperfectly, through years of being the person in the room that other people looked past, was that the work did not require you to disappear into it completely. The work required you to be present for it. Present was different from invisible, and for too long she had confused the two because invisibility had been easier than the alternative. The alternative was this: a name on a document, a phone call you answered, a warrant for a person who had spent 9 years believing that the small, quiet, unnoticed people were safe to use and discard. He had been wrong, not because Sylvie Marsh had been exceptional. She was good at what she did, and she had worked hard, and she had held the line through years when holding the line produced nothing visible. But the specific mistake he had made was not underestimating her talent. It was underestimating what happened when someone who had spent years being ignored finally had the evidence in their hands and nothing left to lose by being seen. You could dismiss a person. You could dismiss their work, their methods, their credentials, their presence in a room. You could stamp insufficient on their applications and route their calls to voicemail and assign them to hospitals with parking lot windows. What you could not do, what Draker and Moss and 14 years of committees and review boards had collectively failed to account for, was make the work stop being true. The compound worked. It had always worked. It worked when nobody was watching, and it worked on a helicopter at 11,000 feet with a flatlined captain on a stretcher and a cabin full of people who had already looked past her. The truth of it had waited, patient and unglamorous. For the moment it couldn't be ignored. She had waited with it. That was the part nobody told you about being the person in the background. The waiting was not passive. The waiting was its own form of work, requiring its own form of strength, The kind that didn't announce itself because announcing itself would have cost more than she had to spend. She picked up her bag. She turned off the office light. She went home through the late Friday afternoon of a town that did not know her name or care about her case study or have any particular feeling about the events of the last several months, which was fine. That was how most of the world worked. The significant things happening inside small rooms while the ordinary world continued moving outside the window. She had spent a long time in those small rooms. She was not done with them. But she walked home in the spring light with her bag on her shoulder and her name on a document that was now permanent. And the road ahead of her had the specific quality of a road that she had built herself. Imperfect, uneven in places, made from whatever materials had been available at the time. Still standing, still hers.